when you look at the Indian continent, the Indians in general, they're having a huge problem with heart disease. Right. So as you were saying, yes, they're surviving, they're fine, but where is that heart disease coming from? So they want to point the finger at ghee, a lot of the saturated fat they may be getting from ghee. Could it be that they're not getting enough of the fish oil and the EPA?
Totally.
That there could be something there.
Oh, yeah.
So they're getting saturated fats, but they're not getting these specific molecules that we need.
But when you got a plethora of food available now, and in the modern world you can do that, now they're getting fat, and they're getting diabetes, and they're getting high blood pressure, and they're getting heart disease.
Well, America was taking over there. Now they have a lot of McDonald's, Kentucky Fried Chicken, a lot of fast food.
So interesting. So this completely blew my mind. We need to take more fish intake. And if we look now at the Mediterranean diet, like you say, it's such a big term. What is it exactly? But could it be that the main thing is that they're eating more fish?
Could be. Yeah, it could be. I mean, of course, there's fresh fruits and vegetables every day. It's a lot of plant food, and that's great too. It's just hard to pick out one thing from that diet.
Yeah. So I think the important thing for us is diet choices. We need to eat more fish, be less scared of the mercury, and supplement with fish oil. Yeah.
And correct me if I'm wrong with this, because I actually preach
You're wrong.
Thank you. Most likely I will. And I'll accept it from you, for sure.
No.
But I tell patients that omegas are literally involved in every cellular membrane in our body, even including our neurons. That by having the right uptake of omegas, you're giving the cell the flexibility and resiliency for nutrients to come in and out and toxicity to get out. Or in other words, for the cell to function properly, because every cell membrane, the integrity of it is built from some form of omegas.
Metabolic flexibility.
Or oils.
Yeah, right. It's certainly part of every membrane. And just the one thing, people often just use the term omegas. But it's omega-3.
Right, omega-3s, correct.
Omega-6s are important too.
Right.
But we don't have a problem getting enough omega-6 in this culture, in our diet. It's omega-3s that's the problem.
Right.
So yes, you're right. They play an important role in every cell membrane.
Even neurons.
Even neurons, right.
That's why the cognitive function. Right. So I think this is a great moment to kind of segue into the difference. Like obviously we've already covered the importance. We need to take these not only for just surviving and existing, but for thriving, right? Which is what we're into. Now there's a huge difference, and this is why I think your work is remarkable. There's a difference between, obviously testing is important, but there's a difference between testing peripheral serum and intracellularly, correct? And so what is that difference, and what is the value of doing it intracellularly?
Yeah, so we're now talking about blood testing.
Yes.
For omega-3.
Yes.
Instead of omegas. but actually, we do test omegas.
Infected you.
We do test for omegas, all of them, Right, so the best way to know what your omega-3 status is to do a blood test. Right. You can't take a piece of your brain and measure it, right, obviously, or your heart. And so we, like 20 years ago, came up with this thing we call the omega-3 index, which is a blood test that we actually isolate the red blood cells. Half of your blood is red blood cells. The other half is this yellow stuff called serum or plasma, right? And so we get the red blood cells and we measure, which is really the major cell in the blood. And it represents all the other cells in your body. And we measure the omega-3 content of the red blood cell membrane. And we then express it, the EPA plus DHA, we express it as a percent of the total fatty acids in the membrane. And all membranes have fatty acids. And so it's somewhere in the neighborhood of, in the extremes would be maybe 2% omega-3 to 12, 15%. That's kind of the range it lives in. Most Americans live around 5% omega-3 index. Japanese around 10% omega-3 index. I'm around 10%. I take supplements.
That's why you're so smart.
Yeah, you have to brag, huh? Yeah. You have to brag. I got other things that are really good too. You just haven't seen it.
Other reasons, right? So that's this test, and we can do it on a dried blood spot with a finger stick. Right. It can't be done out the bedside in a finger stick. It has to be mailed to a laboratory. Okay, but still, it's quite easy to collect. Yeah. And we pick the red blood cell for a variety of reasons. One of which it's a more stable, steady marker of your omega-3 status. And the analogy we use, at least among medical people, is hemoglobin A1C versus a plasma glucose level, which is plasma glucose up and down all the time. But the red blood cell, which is what measures where the hemoglobin A1C is measured, and it's a very steady, long-term buffered marker. And the omega-3 index is like that, because plasma levels will go up and down, particularly if you're eating salmon last night.
It'll go up.
It'll go up in the plasma, but it won't go up in the red blood cell.
So the index is more historical and average.
Yeah, it gives you more of a historic kind of a 3-month average.
Hence why you say in your blood test, it says to retest every 3 months and a half or something to 4 months, because you want a new cycle of red blood cells before you test the average omega-3 level.
So
How do people not know that? How did I not know that? I check hemoglobin A1C on everybody. I'm sorry. Keep going.
That's it. I mean, all your red cells are turned over. You got new ones about every 4 months.
Could I safely tell patients, we can tell patients to test at 3 months?
Oh yeah. I mean, say you start here and you start supplementing, for example, and you got a blood test here, and the levels are going to go up like this, and it's going to, it's plateau and probably reach the plateau at 4 months, but at 3 months you're 90% of the way there. That type.
And the goal is seeing where you are, and the goal is to get as close to 10% or as high as you can close to it.
We're going to go over that eventually.
Okay, good.
Actually, let's go over it now.
No. Let's keep finishing. Let him finish his thoughts with this.
Yeah, that's part of why we use a red cell. It's been tough in research because when we go to big research cohorts, groups of people like Framingham, all they do is store plasma, because they never thought, well, what am I going to do with a red blood cell? Throw them away. They just throw them away because they care about the cholesterol level. They care about the triglycerides, and all the things they want to measure in serum or plasma. And they've never thought about keeping red cells. So a few of them have. So for research, it's been a little tough because you got to find these places that are saving the right cell type. But the studies that actually led us to invent the omega-3 index were done in early 2000s, late 90s, and where researchers used red blood cell omega-3 levels as a marker of fish intake. It's a kind of an objective way. You can ask people how much fish they eat, but they don't remember and they don't know what kind, So let's just measure a cell membrane that we can easily get out of red cell. And so these researchers in Seattle and in Boston measured omega-3 levels in a bunch of people and found that the question on their mind was risk for sudden cardiac death or primary cardiac arrest, which is kind of the first symptom of heart disease for about half the people that have heart disease, and they die. So they measured omega-3 levels, and they found that people who had the highest omega-3 levels in their red blood cells were like 90% less likely to have sudden cardiac arrest.
Wow. It's a huge number, man.
It's a huge number. And it was replicated in two very different kinds of studies. And it was when that second study was reported in 2002 that a German colleague of mine, Dr. von Schacke, we were having a beer after this presentation had been made at the American Heart Association, and said, damn it, the omega-3 level in a red cell means something. It really is prognostic. It's not just a marker of how much fish. It really is like a risk factor, like like cholesterol is. Wow. Somebody needs to make a test for this thing. So we said, well, let's do it. So he started a lab in Germany and in Munich.
Napkin idea. Napkin idea.
Yeah, it was a napkin idea.
And today is pretty much the gold standard for omega-3 testing.
Look at that.
Because we've continued to do the research with it and build a case.
But how, so it did translate into a prognostic factor. To me, the MD, again, that's what's important. Yeah, how much fish you're taking, but you have studies. Was that part of the Framingham Heart study?
Our first one was Framingham Heart study to show that omega-3 levels were related in that study to risk for cardiovascular disease.
So you and your German colleague invented that test. That's the test that we did, that we're going to see the results, and it has prognostic factors, because that's what we want. We want to prevent heart disease. We want to prevent you dying. So it has a direct correlation with the incidence of heart disease.
Right. And it's not in medicine, you guys have diagnostic tests. And you have prognostic tests. So diagnostic tells you, do you have the disease today, right?
This is a
or not?
prognostic.
But like a high glucose, you've got diabetes.
Right.
But the omega-3 is not like that. The omega-3 test, omega-3, is more about your future risk. It's not telling you what you
Even
have.
more important.
That's amazing.
It's totally
Even more
important because you
important.
can modify it. You can
And
do
this is
something about it.
accepted by the American Heart Association.
Accepted would be a strong word for it.
So I'm a little black and white on this because, again, pardon my ignorance.